The pandemic has caused a lot of people in the LGBTQ plus community to put off cancer screenings. Amber Kapoor is the Health Education Grants and Survivorship Coordinator at Middlesex Health Cancer Center. Amber, what are some of the obstacles that are keeping people from getting screened?
Unfortunately, there are many obstacles that might be in people's way to potentially getting cancer screenings right now. So, that especially with the pandemic, we've seen more and more people losing their jobs or cutting back hours. That may have implications for their insurance status. They might have other barriers such as lack of access to transportation, or sometimes they're unable to get in during certain hours. They don't know that facilities might be open extended hours to accommodate them. And then, of course, with the pandemic, a lot of people have fears around COVID safety.
So what are you doing to combat some of these obstacles and fears?
So at the Middlesex Health Cancer Center, we have strong protocols in place to make sure that we are protecting patients from the spread of COVID-19. We have a vaccine requirement for our staff, thoroughly cleaning in between patients and allowing time in between patients, protocols related to social distancing, visitor restrictions. There are an endless number of things that are in place really to uplift the safety of our patients and our employees.
Well, of course, cancer screenings are important for catching cancer early and not letting it advance. But for this population, there are other risk factors at play, right?
Mm-hmm. Yeah, absolutely. So there are some things, that apply to everybody, but that unfortunately may be more common among the LGBTQ population. So for example, we see, higher rates of substance abuse, smoking, obesity, some of those kind of behavioral risk factors that do increase the chances of developing cancer. And then, of course, there are some things that might be more specific to the transgender population as well. So, for example, there's unfortunately a lack of data out there, but there are some data that suggests that perhaps long-term hormone use may be related to cancer incidence. So just extra important to get screened if you're transgender.
Can it be confusing if you're a trans man or a trans woman to know what kind of cancer screening you should get?
Absolutely. It might. What it boils down to is being really simple, actually. But individuals might be confused. They might, we talked a little bit about barriers. They might be reluctant to come in. Often cancer screenings can be highly genderized. So we talk about breast cancer screening among women. Everything is pink. So if you're presenting male, but really need that mammogram, that might be extra uncomfortable for you. But really, the bottom line is that if you have it, screen it. So that's really the simple message here. If you have breast tissue, it should be screened for breast cancer. If you still have a cervix, it should be screened for cervical cancer, and so on and so forth.
That's really important to mention. Are there any final tips that you think would be helpful?
So I think it's extra important to have a primary care provider that you trust, someone that you're able to be open with, someone who knows that you're transgender, is aware of the organs that you may or may not have, whether you're on hormone therapy, and just really being able to have an honest conversation with them. It's understandable if you're reluctant to get certain cancer screenings. They're invasive to begin with. And again, if you're maybe not super comfortable with your current body, they might be even more off-putting. So just having honest conversations with your primary care provider about hesitations. For example, if you're not willing to go for a colonoscopy, they may be able to talk to you about other options like home-based stool tests, or there may be workarounds if you're uncomfortable with one particular screening.
Amber Kapoor, thank you so much for joining me today and talking about the importance of getting that cancer screening. And just as a reminder, Middlesex Health has 2 cancer center locations, one in Middletown and one in Westbrook. I hope that this information will prompt you to go get the screening that you need.